Hi, I'm your Medicine Baddie, and today I'm going to explain the key differences between type 1 and type 2 diabetes. For medical students, understanding the cellular and physiological differences between these two conditions is crucial. Let's dive into the role of the pancreas, the immune system, and insulin sensitivity to see how these diseases differ. Let's start with the pancreas. Inside the pancreas, we find the islets of Langerhans, which contain four major types of endocrine cells. Alpha cells release glucagon, which increases blood glucose. Beta cells produce insulin, the hormone crucial for glucose uptake by cells. Delta cells secrete somatostatin, which inhibits both insulin and glucagon. The key player in diabetes is the beta cell, as both type 1 and type 2 diabetes involve dysfunction of insulin regulation, but in distinct ways. In type 1 diabetes, the body's immune system attacks its own beta cells. This is an autoimmune disorder where T cells, including CD8 plus cytotoxic T cells, infiltrate the pancreatic islets and destroy the insulin producing cells. This results in absolute insulin deficiency, meaning that the pancreas is unable to produce insulin. Type 1 diabetes typically develops rapidly, often in children or young adults. Common autoimmune markers, such as anti-GAD and anti-insulin antibodies, are found in the blood, indicating an autoimmune attack. In contrast, type 2 diabetes is not caused by an autoimmune attack. Instead, the primary issue is insulin resistance. Over time, the body's tissues, including muscles, fat, and the liver, become less responsive to insulin, a condition known as insulin resistance. The pancreas compensates by producing more insulin, but eventually, this becomes unsustainable. Beta cells in type 2 diabetes become dysfunctional, and their ability to produce and secrete insulin declines. Unlike type 1, there is typically no destruction of the beta cells themselves. Instead, their function deteriorates over time due to chronic hyperglycemia and metabolic stress. Another critical difference is the autoimmune component. Type 1 diabetes has a strong autoimmune component, where environmental factors such as viral infections may trigger the immune system to attack pancreatic beta cells. There's a genetic predisposition with associations to HLA-DR 3/DR4 alleles. On the other hand, type 2 diabetes does not involve autoimmune destruction. Instead, chronic inflammation caused by visceral fat and obesity contributes to insulin resistance. Though genetic factors play a role, there is no immune-mediated destruction of beta cells. When we talk about insulin sensitivity, there's a key distinction between type 1 and type 2 diabetes. In type 1 diabetes, insulin sensitivity is usually preserved, but the body lacks insulin. This means patients with type 1 diabetes are insulin sensitive, but cannot utilize glucose efficiently without external insulin administration. In type 2 diabetes, insulin resistance is the hallmark. The body's cells do not respond effectively to insulin, leading to elevated blood glucose levels despite high insulin secretion. This insulin resistance is due to a variety of factors, including reduced insulin receptor function and defects in post-receptor signaling. To summarize, type 1 diabetes is primarily an autoimmune disorder that leads to insulin deficiency. Type 2 diabetes is primarily a condition of insulin resistance and beta cell dysfunction, often due to lifestyle factors and genetic predisposition. Understanding these fundamental differences at the cellular level is essential for diagnosis, management, and treatment of both conditions. Thanks for watching. If you found this breakdown helpful, don't forget to like and subscribe for more in-depth medical explanations. If you're interested in learning about diabetes management, complications, or treatments, stay tuned for upcoming videos.